Thank you for the opportunity to present here. And my name is Jeff Lee, CEO of DentX Biomed. So let me start with the short story about our establishment of our company. So a 60-year-old implant patient came in with a collapsed jawbone. The bone regeneration was needed in his surgery, but the standard solution, RHPMBT, was too risky to use. So our CEO, an oral maxillofacial surgeon, had to give up at the time about the regeneration. So DentX was built to fix that. So you can see in the slide, RHPMB2 is the standard solution for bone regeneration. And they established the category of bone regeneration in 2002, and they got $900 million market at the time and defined the mechanism standard to amplifying by using protein and peptide. But at 2008, FDA safety notification happens. So even though they have a great market, they lose the market more than a half, and mechanism trust collapsed at the time. So you can see in the right side. So even though that solution is really good, but they have a side effect like local inflammation, swelling, and ectopic bone formation, and the cancer possibility. So far, after 2002 and 17 years, there's no replacement. So we need to develop some solution. So unlike the infuse, the standard solution, we do not inject the protein and release the brake by using targeted protein degradation. So CL144 is the lead molecule we use. So it's a small molecule, and that is the technology to degrading a targeted protein. So we are targeting MDM2 protein, which is holding P53 down, and CL144 clears the MDM2 protein, and then P53 stabilized, and then RUNX2 switches on, the dormant cell become bone-forming osteoblasts. That is the mechanism we have. And unlike RHPMB2 that is a recombinant protein, but we are not that kind of protein. We are a small molecule solution. So our dose is like a microgram scale, not a milligram scale. And because of this, our API cost is 1% of the RHPMB2, like $30 to $50, so much cheaper. And then also, unlike RHPMB2, we have a clean profile and no adverse findings so far. So we have three kinds of probe at this moment. So we published Advanced Science 2025, CL144 matched RHPMB2 efficacy with clean tissue where RHPMB2 causes inflammation. And recently we are doing canine POC using 12 dogs, and we can find out that CL144 matched RHPMB2 efficacy and no adverse findings, even though that is non-GLP exploration. So we find out that there's no adverse side effects so far. And lastly, we established biometric science. So when you input the CL144 to the osteoporosis model, we can find out that bone density increases gradually. So that means CL144 can open indication expansion beyond the local defects. So that is a long-term goal we have. So the bottom line is there is a competitive, like you can see the bottom side, the therapeutics and therapeutic, they are the great competitive we have, but they are really faster growing up, but they are still protein, not a small molecule. So that means we have advantages about that. So go-to-market strategy. So we have two strategies. The first one is Korean dental validation, and the other one is US spine scale. Because our CEO is a key opinion leader and a clinician in South Korea, so we can validate quickest with a lower regulatory burden in dental market, because our CEO is kind of a key opinion leader in dental surgeon market. But we are thinking about that. US spine market is really huge comparatively to dental, so we can at the same time, we can focus on the same molecule and the larger value, and focus on the $750 million US spine segment with the validation process. So we have two teams. The first one is Korean team, and the second one is US team. So as I said before, the Korean team has a clinician and chemist, the renowned chemist and delivery experts, so CEO and scientific lead and CTO and well lab. So they focus on the R&D and IP scientific validation. And the US team, so I'm a regulatory and the merger and acquisition lawyer. So I can lead FDA pathway and go-to-market strategy and venture formation and US fundraising with the contributor Brian and Area. So far, based on the nucleate biotech accelerator, we got a award from the Eli Lilly. So that is one of the evidence that we can be one of the replacement of the rhBMP2 to make a cheaper and safer bone regeneration solution. So that is our timeline to 2026 GLP pivotal talks, and 2027 FDA pre and IND meeting, and 2028 IND filing. So lastly, so we want to find out three kinds of expertise. So in this site, the first one is the US FDA combination product and regulatory strategies, because our precedent is infused. They are focusing on not the NDA. They focus on combination product regulation. So we can follow them, because to reduce the cost and to reduce the period of time for getting approval. And then we want to expand our business model and to become a platform of the targeted protein degradation. So we want to find out protein degrader CMC and the formulation experts. And lastly, for local delivery carrier, we want to find out optionally combination product device and biomaterial engineer. Thank you for listening. Any question? Yes, please.
Do you have to have scaffolding in order to regenerate, or?
Yeah, great question. Thank you. So we have a scaffold like this. So that is the AI image, but we want to use the precedent infused made by Medtronic. So we just want to change the medicine in the middle of the scaffold. So we are developing not the scaffold, just for the ingredient in the middle of the scaffold. Thank you. Yes, please.
Have you thought about using your technology to postmenopausal women's osteoporosis?
Yes, that's a really great question. So we are thinking about that kind of solution too. So far, as you said, we have a great result about the osteoporosis, but we think that we are thinking of that in the long-term goal. That is a really great solution. But when you're researching about the competitive market situation, the osteoporosis is so competitive, and we need to validate our local bone regeneration as a first mover. So after that, that is the first stage we focus on, and after that, we are moving forward to the long-term goal, as you said. Yes, please.
Can this cause any issues with them?
So for my understanding, you mentioned that there is another side effect or other when bone regenerating, right? Yeah, so that's a really great question. So we focus on the side effect, the traditional bone grafts. so they have so many side effects, as I said before, like local inflammatory swelling and ectopic bone formation, because they put the protein to amplify the signal, bone regeneration signal. But we focus on the degradation of the protein to make the mechanism happen by itself. So far about focusing on the POC using canine and the mice and the rabbit, there's no side effect or other adverse effect so far. Yeah, exactly. Yeah, but it's not a CRO made, but it's just for the in-house labs. So we need to move forward by using the CRO and other objective experiment to prove this. Thank you.